I thank you for your courtesy. I've listened, my dear friends and colleagues, to this debate, and I've had governors in my office to talk to me about this business of flexibility. I happen to know that at this time the country has a very severe economic problem, shared by the feds, shared by the states, local communities. We're all in a very tough situation for money and to meet the needs that we have. But the one thing that I've learned as I've listened to everybody talk about what we ought to do about Medicare and Medicaid, governors have come into my office to talk to me and say we need flexibility. And every time I listen to that, I check it out, and I find by the great horn spoon the flexibility is flexibility to cut, not to add, not to offer new benefits or new opportunities for care or treatment. Now, we're talking this morning about the most vulnerable of our people. Medicaid is an inherently unpopular and perhaps even obnoxious problem. And the reason is it's a welfare program. It's not something that you buy and pay for like Medicare. Everybody pays something in for Medicare, and it's just a great program. It's mine. But there's nobody to say that for the kids in S-CHIP, and there's nobody to say that for the people who are old or sick or disabled. So we essentially provide charity for those people. And it's always unpleasant to do this because those are the folk who have the least to speak for them and the most to say, but no way of making themselves heard. So I don't think that this is good legislation. Each state has got these problems. As we have drafted Medicaid and S-CHIP over the years, we have tried to see to it that these programs provide wide discretion to the states. The discretion that is not provided, however, is to cut. And to cut essential parts of the program that we as a matter of national policy have thought should be carried forward. And one of the problems that we find here is that we can't give but so much discretion to the people in the legislatures and in the governor's office because we find they will cut back. One of the reasons that the federal government is in this business is that the states were never able or willing to do what they had to do. And so Medicaid was passed when we had a Democratic guy by the name of, well, he was the chairman of the Ways and Means Committee, Wilbur Mills. And he wanted to have something to substitute for Medicare and something to head off the dreadful threat of a program of national health insurance where people began to pay for this kind of expenditure. Well, we passed it, and everybody said, great, now we're going to solve the problems. And we've heard nothing but criticism from the states and everybody else about this, which was accepted in part by people who were willing to go along with it, not because it was good, but because it was something that would substitute for something that they didn't want a whole heck of a lot more. Now, having said these things, we've already rejected an amendment which said you can't cut the kids. I was chairman for a long time, and for a bit of the interim in my time in holding that job, the then President Bush came up with the idea that we ought to pass S-CHIP, and by golly, we did. It turned out to be a great thing. And we labored for years to try and get all of our kids covered. Now, the kids, again, are important to us. They are 25% of our population, can't speak for themselves, but they're 100% of the future of this country. If you don't take care of those kids and you don't educate them and you don't give them the health care they need, they're not going to be economic units. They're not going to be valuable to us in a world competition. The case, I think, cannot be made quite so well for the rest of the Medicaid beneficiaries. They're just people who are down on their luck, suffering, and they don't have any way of getting health care. Except they do one thing. They run to the emergency rooms where they get care. Somebody's paying for that, and nobody's going to kid me to tell me that you and I in this room who have health care programs that we pay for aren't paying on that money, because we are. So don't kid yourselves. These programs that we have before us, these to repeal Medicare or cut back on Medicare or S-chip, are simply going to shift the costs around because we aren't addressing the big problem which really bothers us all. And that's the fact that we don't bother to reform the health care system in the United States.